بسم الله الرحمن الرحيم. أهلا ومرحبا بحضراتكم في الندوة الخامسة عشر، والتي تحمل عنوان ضيق التنفس عند الرياضيين، إنسداد الحنجرة أثناء المجهود البدني. طبعا بنرحب بحضراتكم والسادة المستمعين والموجودين معانا. بيكون فيها رئيس الندوة الأستاذ الدكتور عماد الدين شعبان علي، أستاذ ورئيس قسم العلوم الصحية الرياضية، كلية التربية الرياضية، جامعة أسيوط. مقرر الندوة الأستاذ الدكتور جمال عبد الناصر، قسم العلوم الحيوية والصحية الرياضية، ولكن هو اعتذر لظروف خاصة. المتحدث الدكتور جيمس هال، جامعة لندن الإمبريالية، المملكة المتحدة. طبعا بيشرفنا وجود الدكتور ريان جمعون ترانزليشن، الدكتورة آمنة مرقسي في ترانزليشن. اتفضل يا دكتور عماد.
بسم الله الرحمن الرحيم. طبعا في البدايه انا بحب ان انا يعني اشكر جامعه الاسكندريه ان هي يعني بادرت بعمل مؤتمر بعتبره هو الاول من نوعه في الشرق الاوسط، ان هي تدير مؤتمر بالضخامه دي والكم والزخم العلمي الخاص بعلوم الصحه الرياضيه. اسمحوا لي ان انا اقدم شكري لسعاده الاستاذ الدكتور عبد العزيز قرصوة رئيس جامعه الاسكندريه، والاستاذ الدكتور محمد عبد الحميد بلال عميد كليه التربيه الرياضيه جامعه الاسكندريه ابو قير، والدكتور الاستاذ الدكتور عبد المنعم بدير عميد كليه التربيه الرياضيه جامعه الاسكندريه ابو قير الاسبق. واخص بالشكر لاخي وزميلي العزيز الاستاذ الدكتور احمد عمران رئيس قسم العلوم الحيويه والصحيه الرياضيه بكليه التربيه الرياضيه ابو قير جامعه اسكندريه. يسعدني ان انا ازامل في الندوه العلميه انه يكون معايا الدكتور جمال، ولكن لظروف خاصه عن ان هو يحضر، فبالتالي اعتقد انه ممكن يبقى معايا دكتور عزمي، وانا سعيد بوجودك دكتور عزمي، من فتره جامده ما تقابلناش مع بعض. والندوه ان شاء الله اللي هيتكلم عنها بروفيسور جيمس هال من جامعه لندن الامبرياليه بالمملكه المتحده، وبيكلمنا عن موضوع في غايه الاهميه بالنسبه للرياضيين. اعتقد ان انا يعني على حسب ما فهمت من العنوان ان هو هيتكلم عن الازمه فور سبورتس او ما يسمى بضيق التنفس عند الرياضيين، بس هو هيتكلم بشكل متوسع في هذا الموضوع، وده من الموضوعات الحيويه الجديده في مجال فسيولوجيا التدريب الرياضي. والدكتور الدكتور جيمس هال هو يعني من حسن الطالع ان هو بيكلمنا في موضوع متخصص بامراض الصدر، ان هو طبيب متخصص في امراض الصدر، وكمان هو اللي عمل او بدا يضع النواة واللبنه الاولى للعمل العلمي في مجال امراض الصدر لدى الرياضيين. هستاذن حضراتكم ان هو يبدا الدكتور جيمس هال في عرض للموضوع الندوه بما لا يتعدى 30 دقيقه ان شاء الله، وبعد كده نترك 10 دقائق للحوار والمناقشه.
Dr. James Hall, we welcome you to start your symposium.
Well, thank you very much. It's very nice to be invited to speak to you today. I prefer to be with you in person, but this is a second best. And what I'm going to talk to you about are problems relating to asthma-type problems in the athlete or athletic individual. My background is that I work, as you've heard already, at the Royal Brompton Hospital, but also for the Institute of Sport, Exercise and Health. But I'm also interested in working for various anti-doping bodies and also the International Olympic Committee for a task force for respiratory illness in athletes, and also within the UK for our Thoracic Society, the British Thoracic Society. What I want to cover are three main questions. I'm going to cover about breathing problems in athletic people, and I'm going to start by talking about whether this is a real problem or whether it's an imagined problem that I simply invented to create a job for myself. I'm then going to move on to talk about how you assess this type of problem. What are the questions you should ask? What should you think about when you see an athlete with breathing problems? And then I'm going to finish by talking about what are some of the treatments that we use to help athletic people with breathing problems. So if we think about athletes and breathing problems, and this is a survey, a questionnaire survey from about 700 athletes in Canada a number of years ago, and they asked this group of individuals, when you do exercise, how often do you get problems with breathing, chest tightness, or wheezing? And you can see how common these problems are, where problems like breathlessness are present in about 50% of athletic individuals within the previous year. And also symptoms like wheeze and cough are very common symptoms. They're far more common than any other symptom that an athlete might struggle with. At the very elite or professional level, we often see many cyclists or endurance athletes using inhalers. And indeed, a study that I did showed that 70% of the Team GB swimmers had evidence of asthma that we were able to confirm. And about 1 in 4 cyclists have some form of exercise-induced asthma. If you look at applications to use inhalers across Olympic Games, you can see that the number is slightly lower, but still very common. Almost 1 in 20 to 1 in 10 individuals ask to use an inhaler at an Olympic Games. And this is particularly common in athletes who are engaged in endurance sports, triathlon, cycling, swimming, where the prevalence of asthma-related problems are very common, whereas in sports like shooting or wrestling, the prevalence is much lower. And we think that relates to the fact that when you're doing endurance sport, you're often breathing very high frequencies for very long durations, often in environments which are not very good for the lungs, such as when you're cross-country skiing or when you're swimming. So I would say that this isn't an invented problem, it's a real problem. Breathing issues, wheeze, cough, and breathlessness are very common. They're the most commonly reported medical issue, and it's the most common reason an athlete reports an illness or reason that they need to use a chronic medication. That's particularly true in endurance sport athletes and less common in more detailed sports like shooting. Happy for me to go on?
I think it's a good time for translator now.
Excuse me, doctor. We are now going to translate the participants. إذا لقد تناول الدكتور جيمس هول موضوعا جدا مهم تمحور حول ضيق التنفس لدى الرياضيين. بدأ خلال مداخلته في ذكر بعض أعراض أو مشاكل التي تحدث على مستوى الجهاز التنفسي، ممثلة بذلك في ضيق الصدر، الصفيرة، السعالة، حصول البلغم، كما تم توضيحه في البيان الذي عرضه الدكتور. كذلك في مداخلته قد أبرز أو تحدث عن الدراسة التي هدفت إلى النظر في مدى انتشار أعراض الجهاز التنفسي التي يعاني منها الرياضيون، والتي قامت بها مجموعة من 698 رياضيا، 107 منهم مصابين بالربو المشخص أو نستطيع أن نقول أو المبلغ عنه ذاتيا. تمم الاستبيان حول حالتهم التنفسية، وكانت الأعراض السابق ذكرها مرتبطة بالتمارين الرياضية والممثلة في ضيق التنفس إنتاج البلغم، الصفير، السعال، وضيق الصدر. إذن يشير أو أشار الدكتور إلى أن الربو منتشرا بنسبة 70% لدى السباحين وسائقي الدراجات من رياضي النخبة في اليونايتد كينغدوم. وفي محور آخر ذكر كذلك أن بعض المشاكل التنفسية التي تحدث في أو جراء ممارسة الرياضة ينشأ منها في حالة الإغفال عنها وإهمال المراقبة الطبية أمراض عدة، ممثلة في مرض الإنسداد الرئوي المزمن وارتفاع ضغط الدم الرئوي إضافة إلى التهاب الجهاز التنفسي. Doctor, you may proceed with your symposium.
Thank you. So the next question I want to cover is about how do you assess this issue? So of course, whenever you see someone who is breathless or is struggling, then of course, lots of different potential diagnoses become relevant. And you, of course, you don't want to miss any pathology or a disease state. And you will know, if you're practicing clinicians, that there is a great long list of causes for breathlessness. In fact, I think the last time I looked is 120 different causes. Fortunately, in athletic individuals, this list is much shorter. But of course, just because someone is an athlete, it doesn't mean that they can't have any other cause for their breathing problems. So they might have a respiratory disease that you see in the general population. They might have a cardiac disease that you could see in the general population, or they may simply be anemic or have problems with thyroid. It's important, therefore, that you do the simple basic tests like a chest x-ray. And here it shows a small pneumothorax, which was causing breathlessness in an athlete that I was seeing that nobody could work out why, and a blood test to look for anemia. Also for heart tracings to look for heart problems that might cause breathlessness. This is a tracing here of an abnormal ECG. This is Donald Trump's signature. But fortunately, in most people, the two main diagnoses that cause breathing problems in athletes are either asthma or exercise-induced bronchoconstriction, EIB, or this condition which I'm going to show and talk about called EILO, or exercise-induced laryngeal obstruction, where the problem lies at the level of the throat. Now, in order to make these diagnoses, you need to do special breathing tests. This is a video showing someone doing a test called EVH, which is a special airway challenge test. You may have tests such as metacholine or histamine challenge tests, and they're looking at the airways to see how reactive they are to make a diagnosis of asthma. In this test here, you see, this athlete is breathing in a cold, dry air, and then we measure the lung function before and afterwards to see if the airways have narrowed. In this study we did a few years ago, we looked at professional footballers from teams like Manchester United and Newcastle. And we used that EVH test to work out whether a diagnosis was correct or not. And in 42 athletes, we did this test. And what we found was that using special tests, over half of the athletes didn't have a positive test or evidence that they had asthma. And in fact, it's one of the things that I always talk about, that in an athlete who comes to see you, who reports a wheeze or breathlessness, it's really important that you do objective, decent tests for asthma to confirm the diagnosis, because more often than not, it will be wrong. And so when you sit with an athlete, it's really important that you don't simply just rely on their symptoms or their resting lung function, which will likely be normal. You do the basic tests well, like a chest x-ray and blood tests, but you also do good tests for asthma, looking, for instance, at FeNO or a bronchoprovocation test.
Yes.
I'll stop there for a moment.
Okay.
Yes, thank you, sir. I will be translating now. وفي محور آخر ذكر الدكتور بعض المشاكل التنفسية للرياضيين، حيث ينشأ منها في حالة الإغفال عنها وإهمال العواقب الطبية أمراض عدة، والتي تتمثل في لدينا مرض الإنسداد الرئوي المزمن، وكذلك ارتفاع ضغط الدم الرئوي والتهاب الجهاز التنفسي. وهنا تكمن ضرورة المراجعة الطبية واتباع التنظيمات العلاجية. وقد ذكر الدكتور في مداخلته على أهمية التشخيص للحد من المشاكل التنفسية في الرياضة، ووجب القيام باختبارات عالية وعلمية للعلاج المبكر لهذه المشاكل. كما أنه يؤكد أن الربو لا يتم تشخيصه فقط انطلاقاً من وجود أعراض مثل الصافية. وفي نفس السياق ذكر الدكتور أن يؤكد على أهمية التشخيص والعلاج المبكر لهذه الأعراض من خلال تقليل التعرض للمسببات والفحص الإجباري كذلك، وتناول الأدوية ومراقبة الأعراض بصفة دورية. ومصاحبة لهذه الإجراءات يجب على الفرد الرياضي اتباع تقييمات الطبيب كأجهزة الاستنشاق والكورتيكويين. وشكرا. You may proceed, sir.
Thank you. So, one of the reasons why it might be so difficult to make a diagnosis of asthma when you're chatting to a patient or an athlete is because of this condition called EILO, or exercise-induced laryngeal obstruction. I'm going to show you a video now of an athlete with this condition. And if you listen to the wheeze and the breathing sounds, it will be helpful. I hope you could hear that.
Yes, we heard it, sir. It was clear.
So you can hear that there's a wheezy sound, but the wheezy whistling sound is on breathing in. And that is because the narrowing or the problem with the airway is in the extrathoracic airway around the voice box region and the larynx. Now, years ago, people recognized that horses had the same problem often. Equine thoroughbreds had a roaring noise when they're exercising in the trots or in races. And so vets started to evaluate this area by putting a camera scope in and then looking at the larynx here whilst the horse was exercising on a treadmill. In Scandinavia, in the early 2000s, they started to do the same thing with human athletes. You can see here a laryngoscope that goes in through the nose with a mask, and it sits at the back of the nose to look at the voice box. I learned this technique from Scandinavia in 2010, and here's me with a camera. This is the laryngoscope going inside my nostril, and it stays on headgear while I then go onto a treadmill to do some running. I'm going to show you one of my athletes now who came to me with difficult to treat asthma. Here you see the athlete on a bicycle with a laryngoscope, and this is the view at the back of the throat, the larynx, where we can see what happens when she's trying to exercise. These are the vocal cords. Here is the back of the laryngeal wall, and these areas here are very important to watch. They are called arytenoids.
Just try and keep your head nice and still, looking forward like that. Really good, really good.
She's exercising hard now.
That's it, keep pushing around, keep pushing.
Well done, Rebecca.
That's it.
Option number 5.
That's nice, Rebecca. Keep pushing, keep pushing.
Well done, Rebecca.
That's nice. Drive it, drive it, drive it. Keep it up there, keep it up there, keep pushing.
Yeah, Rebecca.
And I hope you can see how marked this is, this closure, and why athletes report sometimes that they feel like they can't breathe in or they're breathing through a straw. And this is the diagnosis of exercise-induced laryngeal obstruction, or EILO. And of course, you know as an audience that clinicians know that not all wheeze is asthma. Sometimes it comes from other parts of the airway tree. We did a study in Copenhagen a few years ago where we looked at about 90 athletes who had wheeze and breathlessness. And what we found here was that a diagnosis of EILO was as common as a diagnosis of asthma, and that in some athletes, there was both EILO and asthma in the same athlete. This is really important because it means that EILO is a very common condition or a problem, and it also means that the two conditions can overlap, which means that that's why people aren't responding to asthma treatment, because they might also have EILO, and you need to treat both conditions to improve things. Some people ask me, is there any way we can tell the difference between EILO and EIB, or exercise-induced bronchoconstriction? EILO tends to occur when someone is working very hard. So when someone is sprinting hard, or they are when they're swimming very hard. And when you start to slow down, it starts to settle down. Whereas asthma or EIB can often get worse when people stop exercising. Also, EILO tends to be in the upper part of the chest, and it's a wheeze breathing in rather than breathing out, which is what happens in exercise-induced asthma. But of course, the best test is to have a look with a camera, and we do this in different ways. So sometimes on bicycles.
Well done. Keep going.
Sometimes on rowing machines, and sometimes even with swimming, so that we can see when an athlete is doing their exact sport, are they getting closure in the voice box area? So for this part, my summary in English is, please remember EILO is very common. It's almost as common as asthma as a cause of wheeze and breathing problems in athletes. And probably 1 in 20 young athletic people have this as a problem. I'll stop there.
Thank you, doctor. كما رأينا في الفيديو المخبري الذي قدمه لنا الدكتور أن حركة الحنجرة أثناء قيام الرياضية بالجهد البدني نتج عنها صفير، وكان ذلك بسبب حدوث ضيق في الحنجرة. كما أنه أشار الدكتور إلى أنه ليس كل صفير يعد أو يدل على وجود الربو. وفي نفس السياق لقد ذكر الدكتور أنه 1 من أصل 20 شاب رياضي يصاب بانسداد الحنجرة. وشكرا. You may proceed, sir.
Okay, thank you. So for this last section, I'm just going to talk briefly about treating breathing problems in athletes. And I could give a whole talk on this, but I'll try and just pick out some important things. And for me, there's always 3 easy steps to a successful treatment. And step 1 is to get the diagnosis correct. So if you're trying to treat asthma and the athlete has EILO, you're not going to be very successful. And so for me, step 2 is also get the diagnosis correct. And believe it or not, step 3 is the same, because the treatments are relatively simple, but the problem lies with people trying to treat the wrong condition. And that is why people go up in their asthma treatment and they never really had difficult to treat or severe asthma. What has changed from the way that we treat asthma is that in the olden days, we used to give athletes a blue inhaler, Ventolin or salbutamol, and get them to use that whenever they needed it or whenever they did sports. The problem for many athletes is that they tend to exercise every day or often twice a day. And so you're giving them a lot of blue inhaler without any steroid or other treatment, which we now know is not very sensible for the treatment of asthma. So I tend to recommend that people follow the GINA guidelines, and many of my athletes are now treated with an as needed inhaler with formoterol and an inhaled corticosteroid. Other athletes are treated with some maintenance of steroid and something like an anticholinergic inhaler. It's important not to forget that there are non-pharmacological treatments. Things like a good warm-up before exercise. And by a good warm-up, I mean people doing sprinting, not by slow warming up gradually. Sprinting is very good for athletic individuals with asthma to get the airways to respond better. Some people encourage nasal breathing, or if the environment is very cold weather, to wear a mask or a snood. And here you see an athlete with a special heat exchange device which keeps moisture in the airways. We also recommend things like fish oil or vitamin C in some individuals, although the evidence is not very strong in this area. For EILO, the first and the most important thing is explaining the diagnosis to the athlete, because the first time they think about that, they then think, this makes sense. I understand where the problem is coming from, rather than from some form of asthma which hasn't been treated properly. We then use special breathing techniques to try and alter the airflow through the back of the throat and keep the throat open. Sometimes, if this doesn't work, we use laser surgery, and we use this particularly for professional or elite athletes who have EILO that hasn't responded. And so here you'll see the surgeon I work with at Charing Cross Hospital. And if you remember, the problem in EILO is the structures above the vocal cords folding in. He now operates to take those structures away with a laser. And as he cuts them away, then it stops them from folding in and causing the problem. And we have great success with this, particularly in international athletes and professional cyclists. So I will stop there with my final conclusion. I'm very happy to take questions, of course, but I would say that respiratory problems and breathlessness and wheeze are very common in athletes. And if you're looking after athletes, it's really important that you understand this problem, because it's something you're likely to see a lot of. It's important to do good diagnostic tests, not just accept what someone says, oh, it sounds a bit like asthma, because we know that that's a very poor thing to do and it's not very accurate. Don't forget EILO. It's present in 1 in 20 young athletes, but it has never really been studied outside Europe very well. And so we need more work from different global centers. And if people are interested in talking to me about studying this in your area, then please do drop me an email, because I'd be very excited about collaborating with you. And don't overlook the basics in asthma care. And so use the GINA guidelines, think about non-pharmacological ways of treating this condition, but think about good care as well. Things like inhaler technique is very important. These are all my contact details for anyone who's interested, and I'm very happy to take any questions after the last translation. Thank you.